Thank you, everyone, for joining us today. We'll make sure we're live here.
We're live.
All right, it appears that we are live, so welcome and thank you again for joining us. I am joined here with Dr. Loren Hamel from Spectrum Health Lakeland and Nicki Britten from the Berrien County Health Department. So we're going to go ahead and jump right in. There's been some recent announcements by the governor in terms of the Michigan Back to Normal program. So do you want to kick us off and just explain what that means and what the community should know about that?
Yeah, absolutely. So last week, Governor Whitmer unveiled the My Back to Normal plan, and it really lays out some different steps and phases that we can move through and how epidemic orders are likely to shift as we reach different rates of vaccination throughout the state. Now, these percentages, that's a state percentage, not necessarily each individual county, but if every area sort of focuses on how do we get to those benchmarks, we'll get there. The ultimate goal is to vaccinate 70% of the state's population, 16 years and older, because at this point in time, we do only have vaccinations for those 16 and older. It may not always be the case, but 16 and older are used for the benchmarks for this plan. So once we hit 55% of Michiganders vaccinated, and that's 4.4 million people, and once we hit that 55%, first dose, and then 2 weeks, because we want people to have reaped the benefit of that first dose before there's a change to epidemic orders. But once we hit that 55%, that is when the requirement for remote work or work that can be done remotely to be done remotely, that requirement will be eliminated. And so that would be something that would then be up to businesses as opposed to a mandate. To reach 55% in Berrien County, we're going to need 68,000 residents with their first dose. 60% is the next step. And once we have 60% of Michiganders vaccinated, that is when indoor capacity at sports stadiums would increase to 25%. Indoor capacity at conference centers, banquet halls, and funeral homes will increase to 25%. Exercise facilities and gyms will increase to 50%. And it would lift the curfew on bars and restaurants. So a lot of increases in capacity and in some abilities in indoor venues once we hit that 60%. 60% of Michiganders is about 4.8 million people with that first dose. Here in Berrien County, that's about 74,000 people. At 65%, all indoor capacity limits would be lifted and only require social distance between parties. So there might still be some facility restrictions there, but there would be no set percentage rate from the state. And then there would be further relaxations on the limitations of residential gatherings. And to get to 65%, that's 5.2 million Michiganders and 80,000 Berrien County residents would hit 65% here. And then 70% of Michiganders, once we hit that, the gatherings and face mask orders that are in place would no longer have really broad mitigation measures with the exception of some unanticipated circumstances that arise. If there are vaccine resistant variants or some other really compelling mitigating factor that may still be in place, but once we hit 70%, that is when we can see the epidemic orders really not being part of our daily lives anymore. That's 5.6 million Michiganders and 86,000 Berrien County residents. So there's this pathway forward of how do we utilize vaccination as a protective factor to be able to change some of the broad mitigation strategies we've put in place. Even with this plan, we still have the need to maintain social distancing. We still need to practice all of the basics that we have been doing and continuing to get there, but it does continue to incentivize getting our populations vaccinated. Where we sit today, we are at 57,000 people that in Berrien County that have received their first dose of vaccine. So we're at about 46%. So we've got a little bit of work to do before we start hitting those different steps along the My Back to Normal plan. But again, that's a benchmark. It's not once Berrien County hits it, we get to move through those things. That is a statewide movement through those stages. But everything we do here in Berrien contributes to that, and it remains really important.
So I have to ask you this question, Nicki. Given our current trend lines of vaccination rates, I heard we're at 57, getting close to 58,000. On the current trend lines, when are we going to hit that first threshold?
So I'd say a lot of that is in the hands of the community. When we think about vaccination and this effort and how do we get more people vaccinated, I think everybody can understand that there are some people who have been highly vaccine motivated. They're on one end of a spectrum here. They have done all of the things to seek out vaccine appointments as soon as it's been available for them. They have gone out of their way to become vaccinated. And that's been very helpful. And that's a large proportion of the people that have been vaccinated so far. We also know there are some people in our community and across our state that are just never going to be vaccinated for one reason or another. And that is okay too. There's no mandate on this vaccine. However, we want to make sure people who are making that decision are doing it with really, really good, accurate information and full understanding of the risks and the benefits on all sides of that decision. But there's a wide space there in the middle between the people who are motivated and the people who are absolutely not going to do it. There are a lot of people out there who are willing to be vaccinated, but it's really more about convenience. If they don't have to plan really far in advance, if they don't have to use a confusing website to make an appointment, if they can just drop by or somebody comes to where they already go and it doesn't have to be extra effort on their part, a lot of people that are currently unvaccinated, I think would be very willing. So it's definitely slower progress. It's taken us 4 months to get to 46%. It might take another few months to get another 10% of our population. So I do not predict that we as a state are going to get to 55% in the next month. But some of that does have to do with the people who are more vaccine convenient as we are adjusting our strategies as healthcare providers in Berrien County to get vaccines to where people are instead of expecting people to come to us. That's going to help accelerate. But you're absolutely right that the rate of vaccination is certainly slowing down and we want it to continue to increase.
Mm-hmm.
Great. And on that note, we do have appointments available at multiple locations within the health department and Lakeland, including a large Pfizer clinic tomorrow at Watervliet High School, which does have walk-in appointments. So if that's something that interests you, we encourage you to just show up and we will get you vaccinated. So we do have a couple more questions on vaccines, but we're going to jump a little bit to just the COVID trends in our community. It's still very real in our community. So Nicki, can you share just the COVID data that we're seeing here locally?
Yeah, I'm pleased to report that we are continuing to see a decline in cases. We're at an average of about 36 new cases per day over the last 7 days. So we peaked a couple weeks ago around 60. We were in the 50s for a period of time. We hit 60 and we've been gradually coming back down. Our increase and then flattening and then decrease has somewhat mirrored the trend in the state, but fortunately Berrien County had far fewer rates of cases than many areas of the state. Our percent positivity has somewhat stabilized around 12%. And 12% probably seems high. For a long time, we were at 5%, 7%. We got used to those single digit numbers. Some of the ways that the tests are being deployed now and some of the people who are how people are getting funneled to the tests is making it more likely that we're going to find some positive tests. So I know there's some effort underway to really help re-normalize the interpretation of that data. So I wouldn't necessarily be alarmed that we're in the double digits at this point. Our hospitalization rates are decreasing, our case rates are decreasing, our deaths are definitely down. So all of those things working together give us a good picture. I don't want people to get too hung up on a double-digit percent positive rate.
Thank you. And Dr. Hamel, how does that translate to what we're seeing in the hospitals at Lakeland?
Yeah, those decreasing trends, gradually decreasing trends in the community are something we're seeing in the hospital, as you can imagine as well. We're running in the mid-30s. And when we talked a few weeks ago, we were running in the mid to high 40s. We've been as high as 80 in November of last year. So we're encouraged that those numbers are going down. I would just caution all of you out there that this is still making younger people very sick. You know, the folks that come to the hospital, it is not an easy journey at all. They're very sick, on oxygen, some on ventilators, and some still passing away. So although we're grateful the numbers are down, it still is not, it's not an easy trend for those that happen to get sick. The second I would just say is this is utterly exhausting the healthcare teams across the state, and including at Spectrum Health Lakeland. We have been fighting so hard and so long against this virus that, in fact, around the country, healthcare workers are just burning out from the constant stress and the constant tension of taking care of very sick people with this disease and losing too many with this disease. So although the numbers are going down, we appreciate everything you can do to protect yourself and help ensure that those are protected around you. So we don't need to meet you in our emergency room and talk to you about how much oxygen you're going to need, or whether or not you're going to have to go on high flow, or whether or not you're going to need to be intubated. That is not a journey you want to be on. So please continue to be careful.
And we are going to transition back to vaccines a bit. So we know that the CDC recently recommended resuming the J&J vaccine. What should we know about that, and how is that looking in terms of rolling that out here in Berrien County?
Well, Nicki will have something to say about this too, I'm sure. Around the country, people are treating that J&J vaccine in a couple different ways. Some are just saying it's way safer than the virus. It is. If it's available to you, you can take it. There are other folks that are saying, you know, I'd prefer to give you Pfizer or Moderna, but if you want the single dose J&J, we'll give it to you. There are a few places that are saying, including in Western Michigan, that are saying we'll give it to everybody except younger women. And of course, the reason for that is the younger women had about 1.5 million chance of a serious blood clot. And that's low risk, but it is a serious complication. We know the virus has a higher chance of giving you that same complication by manyfold. But so there's some variability. It's back in Berrien County. It's available. I think the health department has it currently. And from a medical standpoint, it is absolutely safer than the disease it's trying to prevent. Nicki, did you have more to share about that?
Yes, I mean, we do have Johnson & Johnson vaccine available. I mean, in fact, we had a clinic this morning where we had hundreds of people that wanted it. But we are definitely very clear in what vaccine products we're using in our various clinics. So if you have some sort of preference based on your risk or just your preference, you are able to choose which product. We are fortunate that we're in a situation where we do have all 3 vaccine products available in our community in ample supply. So there really is that option. There are some people that still have the appeal of the Johnson & Johnson. For those who have had some anaphylaxis or severe allergic reaction to vaccines in the past, the Johnson & Johnson still remains a really good option. So there's lots of nuanced situations. We do recommend you speak with your healthcare provider, or you can call our hotline. We won't give you specific medical advice, but we can answer questions about the vaccine. But again, we really want to make sure people are making the right decisions and asking the right questions of the right people so that you can get that accurate information.
The other thing I'd say about the vaccine, and we suggested this early, you know, it wasn't very many weeks ago that we had lines in our computer registration, sometimes lines at clinics, a lot more people that wanted the vaccine than we had vaccine doses. Around Berrien County and around the country, that now has shifted. We have more doses than we have, you know, willing arms. And so we're modifying the way we interact with our public to try to encourage in the most convenient way for you to get that vaccine. We're taking it to doctor's offices, other places where people are just normally flowing through to make it as convenient as possible to get the vaccine. But, you know, around the world, this is not over yet. As you have probably heard, we've had more new cases in the world in the last 2 weeks than the first 6 months. It is not over yet. And every time you have that kind of explosion of new cases, we absolutely expect variants to come out of those kinds of experiences. And those variants have mostly, the ones that we're concerned about, have mostly been more contagious and sometimes more deadly. And the best way to protect Berrien County, the best way to get, the decreased measures that Nicki was talking about at the beginning is to get vaccinated. I believe, I've said this before, we're all going to get antibodies against this virus. We're going to get it one way or the other. You can't escape it forever. It is going to be an infection or it's going to be a vaccination. And if you're 6, the infection, there's not much evidence is harming very many people that are that young. And probably getting natural antibodies are mostly okay. If you're 30, that's not so good. If you're 40, markedly more dangerous to get the infection than the vaccination, markedly more dangerous. And I would say also at Spectrum Health, we are seeing children in the hospital, and we're seeing pediatric deaths in Michigan. So it's not impossible to get very sick. When I talk about, relative risk, that relative risk is not 0 for anybody. There's no absolutely safe. Well, I'm going to take my chances with the infection. You're taking risk. Well, I'm going to take the vaccine. You're taking risk. For almost everybody that's an adult, 16 and older, the risk of the vaccination is so much less than the risk of the infection. We would just encourage you, make a plan, you and your family, encourage your friends. We're going to get through this quicker, the quicker we all have the antibody, and the less likely we are going to experience a serious variant in our community.
And the thing I would guess to just add to that as some encouragement, I know we've been hearing a lot from people who are concerned about the vaccine side effects or can't find a convenient time for them to potentially be feeling ill from the side effects. And I think it's really important to note that it's not everybody who has the side effects.
No.
Far from everybody. Side effects do happen, and it's because of your immune response, which is showing that there is a good immune response. So that's not necessarily a bad thing. We know it can feel like an inconvenient thing, but please know not everybody experiences those side effects. Some people who do experience side effects, it does not impact their day, and it's usually resolved within 24 hours. So I know that's on a lot of people's minds, but that doesn't need to be necessarily the thing that dictates the decision. And it's a lot more inconvenient to become sick with COVID, experience those symptoms for days, have a 10-day isolation period, all of those things. It is better to be able to have the potential for side effects with the vaccine than it is to become ill.
Yep, you're absolutely right.
And there has been a lot of discussion about the emergency use authorization for a vaccine for 12 and under. What do we know about that, and what should parents of those age groups know?
So I think it's 12 and over. So 12 to 15-year-olds would be the new group that's under consideration. We have heard today that I think the FDA is meeting on that matter next week. I think that it sounds like the data coming out of the clinical trials was favorable. So I think, again, that if parents are able to get their children vaccinated because they're of the right age, that would be the appropriate course of action. That would certainly help that group of teenagers, 12 to 15-year-olds, then be able to participate in some of the summer activities they might be, like athletics, and really reduce the risk to everyone, reduce the risk in the broader community. So we'll wait and see what the FDA says and what the ACIP says. We are making plans as a community for how to then meet that need under those newly created criteria so that we can make sure it is convenient and accessible for those age groups as well.
No, that brings up a very interesting kind of related topic, Nicki. We talked earlier on, we're not requiring it. I don't know of anybody in our county that is requiring it. But around the country, there are starting to talk about it, and there are a few that are. There are schools that say if you want to live in our dorm, you have to prove you've been vaccinated. There are folks that are saying if you're going to play sports in this facility, you have to be vaccinated. There are some employers that are starting to have that conversation as well. There's some employers that are requiring vaccination before they employ you. So, and I recognize there's a lot of consternation around the community in every community, not just here, about the notion of requirement and, your rights and somebody else's rights and what's best for you and what's best for the population. I get all that controversy, but at least I've seen the wind start blowing a little bit over the last couple of weeks, and more folks coming out and saying, this is going to be better if more of us get vaccinated and are starting to encourage it or require it. Hasn't occurred here yet. I'm not going to be the first to say, let's do that. But I'm really interested in how that's working in other places. And I think we all should be watching that experience and seeing what the results are.
And there are some folks that are missing a second dose. Either they need to reschedule or it just didn't work for them. And we've recently made it easier for folks to do that. So can you discuss the changes and how people can get a second dose if they need it?
Just call us and we'll do it. Try to get the same. You may find that your first dose was given at the health department and now Lakeland has the right second dose, or the reverse, because some of the vaccine availability has been back and forth. Nicki may have more information about that, but just make sure you're going to a place that has the Moderna or has the Pfizer. But just give us a call and we'll do it. It's never too late to get a booster. If you haven't gotten a booster, you should. If you have concerns about the booster because you had some side effects with that first shot, give us a call. But it's never too late. Come on in, we'll take care of it for you.
Yeah, I think that's absolutely right. Wherever you got your first dose, a second dose did go to that provider for you. That's kind of how the system works. However, there is enough vaccine at all of our providers right now that it's okay. You don't have to. I know 2 months ago, we were telling everybody, no, you need to go back to where you got your first dose because it was in such limited supply. Now that our supply is more ample, we do have that opportunity. So you do have a little bit of an opportunity to choose where and when you get your second dose. And Lauren, you're absolutely right. There really is no time that's too late for your second dose. So if you didn't meet your 21 days or your 28 days, that is okay. If you're 42 days out, 2 months out, that's okay. You can still be vaccinated. The CDC guidance definitely says if that 42-day window has passed, it is okay to receive that second dose and not have to restart the series. You don't have to start over. It's okay. So if you've delayed, don't worry, you can get your second dose. And the health department, you can actually self-schedule yourself for a second dose. So you can now register for a second dose appointment. We used to have a form that people would fill out and then we'd contact you to get you scheduled. It's all self-scheduling now if you're able to do that on the internet. If not, you can call our hotline. We'll help you out there as well. But having that second dose does afford you some more benefits of being fully vaccinated. You can meet in larger group settings with a residential gathering. If it's fully vaccinated individuals, there are occasions to not wear a mask if you're fully vaccinated. So there continue to be advantages to having that second dose of the vaccine. Please seek it out.
And make sure you bring your card back.
That always helps, yes.
It's nice to have it all in one spot. Bring your little immunization card back.
Absolutely.
And last question before we move into closing thoughts, are we seeing any breakthrough COVID-19 infections of people who are vaccinated, or what do we need to know about that?
Yes, we are. The estimates on the efficacy of this vaccine has never been 100%. It's been 95, 96%. Johnson & Johnson would seem to be very good at preventing hospitalization, close to 100%. But we're seeing breakthrough, and we expect breakthrough. Not everybody that you immunize makes an antibody sufficient to ward off infection, and that rate's a few percent. And of course, there's some new strains out there, and not everybody's antibodies are going to work equally against those new strains. From our experience, the risk is extremely low. The folks who are admitting to the hospital now are almost everybody that decided not to be vaccinated. The large majority. There are a few that got vaccinated 8 days ago and they don't have enough antibody. There are very few across our health systems that have had 2 shots. But those folks in general are not nearly as sick, are getting much better, much quicker. So still way better to get the vaccination, even if it's not absolutely 100% effective in preventing a new diagnosis of COVID.
Yeah, and for some context, I mean, we've crested over 4 million people vaccinated in the state of Michigan. And there have been, last data I heard, and this was maybe about a week ago, there were under 300 cases that were breakthrough cases. And while 300 can seem like a lot, 300 out of 4 million is quite low. And the vast majority of those people, it was very, very mild illness, very few hospitalizations and deaths. The hospitalization and death rate amongst that group was far lower than what we've seen amongst other cases. So again, no vaccine provides 100% perfect immunity, but it still dramatically reduces risk of those poor outcomes.
Well, thank you both for sharing your insights with us today. It's always valuable information from both of you. So I will turn it over to you now for any closing thoughts that you want to share with our audience.
I'll just say thanks so much for all you do every day to stay healthy and to keep your friends and family healthy. We thank you for tuning in and joining us for this COVID journey. We wish you all the best health.
Yeah, and I just want to, tell people to just stay encouraged. It's hard to believe it's been over a year since COVID started. And it just kind of helps show that the time does pass and that we are getting to a point where things can start to change and start to shift in the direction I know we all want. I know we're all weary. Stay encouraged. It is saving lives. Get your vaccine. If you're on the fence about your vaccine, have conversations, do some research with reputable organizations and get some accurate information.
Thank you. And as always, the most up-to-date information can be found on our websites, spectrumhealthlakeland.org/vaccine and bchdmi.org/COVID-19. You can find many resources about the vaccine as well as schedule your appointment there. So thank you everyone for tuning in with us today.